Okay, great. Thanks for everyone for joining us today. We have a great speaker, Alyssa Nolff. She's spoken to our group before in the past. It's been a while though, so we wanted to have her back. She's an occupational therapist at Stanford and knows a lot about driving and driving as we get older, driving in general, and driving specifically with regard to Parkinson's disease related issues. And so we're glad to have her give us the lay of the land and if anybody has questions, you can use the chat or the Q&A box and I'll make sure both are working for everybody. So take it away, Alyssa.
Perfect. Yeah, thank you so much for having me. And please let me know if you can't hear me or, like she said, if you have a question you want me to stop or anything. Please let me know. So, yeah, my name's Alyssa. I'm an occupational therapist. I've been working at Stanford for about 10 and a half years now. It's kind of hard to believe. I spent the first 6 years in the main hospital, so doing acute care. And then about 4.5 years ago, I came to the outpatient neuroscience center. So that's where I've kind of really specialized in the neuro population, working with a lot of folks with Parkinson's and also, all sorts of other neurodiagnoses. And part of our clinic, we do a lot of the driving assessments and also driving like rehabilitation, driving training. So it's kind of become an area that I'm quite familiar with, but always there's still a lot of gray area when it comes to driving and kind of the laws with California. So I will certainly walk you through as much as I can today, but happy to answer any of your questions. And yeah, hopefully you guys will learn something. And yeah. Okay, so this is a little bit of our roadmap for today's talk. First, we will review issues that may compromise driving abilities for individuals with Parkinson's. So we'll just kind of go through some common areas that might be impacted and things for you to watch for. Secondly, we will discuss some of the California state laws about driving with Parkinson's and ultimately how to report your diagnosis to the DMV. A lot of the resources I'm going to be pulling directly from that DMV website, so I tried to incorporate as many of the direct links as I could so that you can go back there anytime and read up on what's most current. And then thirdly, I'm hoping you leave here today with an understanding of what a clinical driving evaluation would entail with an occupational therapist and kind of when or how we would kind of come into the picture within your care. So yeah, so that's kind of what we will go through. But again, please stop me if you have questions. I realize I don't know if I can see the chat from my view. So Robin, maybe just let me know if you see anything pop up.
Okay, sounds good. I'll just interrupt.
Okay. Okay, so first, like I mentioned, let's talk a little bit about the issues that may compromise driving ability. So there's kind of three categories that we look at most. The first would be physical. So, this includes a lot of different physical components of operating a car, but basically asking yourself, are you able to physically operate a car? This would include, your strength, your balance. Do you have sufficient range of motion and fluidity of movements, right? Can you be turning your head side to side to check the blind spot? Can you safely get in and out of the car? Are you able to switch pedals, from the gas to brake in a fluid motion and a quick motion if you had to do that in an emergency? Similarly with the steering wheel, right? Being able to turn in both like a slow round turn, or maybe it's a really tight U-turn, or veering out of the way of something, a hazard that's just entered the road. So there's a lot of physical components to driving. It's not about just being able to say, walk to the car and get there. And then, as you guys might be aware, some of the common symptoms with Parkinson's that you may be encountering would be that muscle tightness or rigidity, and then a tremor as well could impact your driving. The tremor, you might think initially that might not impact your driving as much as maybe that rigidity. But again, there's a lot of sort of nuances with driving, whether it is, suddenly there's a hazard and you need to put on your hazard lights, or suddenly something splashes on your windshield, you need to turn on your windshield wipers, right? So being able to find those dials, those buttons quickly in your car to be able to activate them. So a lot of physical components. That kind of go into driving. So those are things that, and as we go through this, I want you to kind of be almost doing a little bit of that self-check as well of, where am I at with driving? Because that is something that's really important, is to be honest with yourself about your abilities. I say this a lot to my patients, but driving is a privilege, right? It's not a right that we get to do for our entire lives. And so it's really important that you be honest with yourself of how you're doing in kind of these three domains, to be able to keep yourself safe in the car, but also any passenger, and then also everyone else in the community that might be out on the road with you. So the second category is the cognitive functioning, right? So are you able to receive and process incoming information quickly and accurately? When we're driving, those decisions that you're making need to be very, very quick. And they're not necessarily things that you might be able to plan for all the time. So a lot of times with patients, they say, I've been driving for years. I could do it in my sleep, right? It's just automatic. And that's true, right? We could probably drive very, very late in our lives if we were just out on an open road with no hazards, nothing unexpected coming at us. It's those unexpected situations that happen very quickly that we have to make a quick judgment call in that moment. So I put an example here. So, you're, excuse me, passing a construction site. Maybe the lanes are reducing. So you're trying to kind of process what's happening there. And then a person suddenly steps out in front of you. What decision are you going to make? Are you going to slam on the brake? Are you going to swerve? Are you going to, hit the cone that's there, right? So all of those decisions that happen really, really quickly. And so common challenges that we would see with our cognition with someone with Parkinson's would be perception, reasoning, our judgment, and then memory. Memory, you might think too, might not play as big of a part in driving, which it's somewhat true, but we still need to, remember where we're going. We need to remember what the road signs mean. We need to remember where we parked our car. So when you're coming, out of your appointment, are you able to find your car safely? So there are a lot of pieces of memory that come into play with that. And then our third category is visual skills. So are you able to gauge the distance from other vehicles, objects, stop signs, and remain in the center of the lane? Other things that might be common with someone with Parkinson's, do you have any blurred vision, right? Any blind spots in your vision? Or we call it visual field cuts. So is maybe the right side of your vision impaired. So you can't really see anything on that one side. Some of these are a little bit more common in patients that say maybe have a stroke or something like that. But again, things to just be aware of that would certainly impact your driving. And so,
Alyssa, excuse
yeah,
me, what about dizziness? Is that fall under visual or physical, or is
yeah,
dizziness? I know a lot of people with Parkinson's disease do report dizziness, so where would
yeah.
that fit in here?
Absolutely. I think dizziness honestly kind of falls into all of them, because
Okay.
if you are feeling dizzy, it's certainly going to impact your balance and your strength. So that comes into the physical piece of it. Cognition as well. If we are so focused, or our body is spending so much energy sort of regulating that dizziness, we really can't think clearly and make those good judgments. And then similar with vision, when you're having sort of that dizzy episode or dizzy spell, you're really not going to be able to focus your eyesight on something. So yeah, dizziness, that's a great one to bring up. I should have included that, because it's certainly a thread through all three of these. Yeah, so then possible challenges with visual skills, again, specific to Parkinson's, would be dry eyes, double vision, and then slowed eye movement. So similar to that muscle tightness, rigidity, we can also have that in our eye muscles as well. So you can think about too, there's a lot of really quick eye movements that happen in the car, whether it's like, flicking your vision up to the review mirror, checking your blind spot really quickly. Um, so all these things that maybe you haven't even, fully thought about when you're driving, there's just so much that goes into it. So again, kind of do your self-assessment on these three categories of kind of where you're at. And Robin brought up a great point about dizziness, and I would add to that too. Some of these symptoms fluctuate, right? And I'm sure you've been noticing that as well. You might have good days, good moments, bad moments. So that's something really important to consider as well. You may be safe to drive one day, the next day might not be a great day, and you need to be able to make that decision of today I am not safe to drive. That does not mean my license is, completely revoked, but I'm going to make that decision today, and I'm going to check in with myself and see how I'm feeling the next day to see if then I am safe to drive. So hopefully that makes sense. Any follow-up questions with kind of these three core components so far?
I don't see anything yet. It occurs to me that just even the ability, to your point about fluctuation, even the ability to say, "Am I safe to drive today?" That certainly gets to cognitive abilities. But that you mentioned possible challenges of having judgment or reasoning. I think,
Yeah.
whether or not somebody could be relied upon to even answer that question for themselves.
Absolutely. And that insight or judgment piece is something that we definitely assess for, and I know our physicians assess for as well. And as soon as sort of that judgment or insight starts to become impaired, that's where we really have to have those discussions of retiring from driving, because you're exactly right. If you're not able to do that self-assessment of whether you're able to safely drive in that moment, that means you are not safe to drive, right? And so that's one of the hardest parts as a family member to um, trying to reason with someone who is losing their reasoning. And that's where I think it does help to have a medical professional kind of relay that information sometimes. And ultimately, yeah, if you're not able to make those good judgments, most of, every day, then you aren't unfortunately safe to drive. Okay, so let's get a little bit into kind of what the California state laws say. So this, again, I've pulled this straight from the DMV website. I would recommend, obviously I've pulled direct quotes in that from the DMV website, but please refer, to the DMV website for the most accurate, up-to-date information, because things do change. So right now, the wording that they use is that certain medical conditions can affect your ability to drive safely, but having a medical condition does not mean that your driving privileges will be restricted. So whether you have an illness, injury, or take medication that causes certain side effects, if you are diagnosed with a medical condition that may affect your driving, you should let the Department of Motor Vehicles know. So very gray area. This is unfortunately where the gray area begins. Um, this would suggest, right, that if you had a medical condition, which I'll talk in just a second, where it actually on the form does list Parkinson's as one of those medical conditions, it is suggested that you let the Department of Motor Vehicles know. So this is your standard driver renewal form. This is typically what would come in the mail. Sometimes you get it by email now. And this is what you're filling out. I believe it's every 5 years to renew your driver's license. So on the very first page, under this disclosure section, there's some medical information. So I know it's a little bit small, so I'll read it out. It says the following conditions that may affect your ability to operate a motor vehicle safely include, but are not limited to, loss of consciousness, episode of marked confusion caused by any condition which may bring about recurring lapses, disease, disorder, or disability. Examples of these are epilepsy, diabetes, stroke, cataracts, Parkinson's disease. decrease or changes in your vision due to cataracts, macular degeneration, diabetic retinopathy, glaucoma, retinitis pigmentosa, or other progressive conditions. Health problems may, or because of alcohol or drug abuse, are also included. So, a lot of information. Let me kind of dissect that for a second. So basically, it's saying, Parkinson's has the ability to potentially impact your driving, in which case they want you to disclose this information. So on section 3, there will be the medical conditions. And this is where you will check that, yes, you do have a medical condition within the last 3 years that may affect your ability to drive. In the section below, there's usually a big section that'll ask you to explain. This is where I really encourage patients to sort of state your case, right? You're going to let them know why you're safe to continue driving. So maybe I see a neurologist regularly. I have gone to physical and occupational therapy. I have talked to my doctor about driving, and they said it's okay. I have kept up with my license and had no tickets. Any of that type of information to just explain what your medical condition is and kind of how maybe, hopefully, it has not impacted your driving. Um, the reason why it's so important to disclose this information is to protect yourself legally. So I hate to bring up the worst case scenarios, but if something were to happen out on the road, even if you weren't at fault for the accident, unfortunately, the other party could pursue sort of legal action and have access to your medical records. If they do find that you have Parkinson's or some visual changes, something like that, you could be at fault for whatever that accident is. So by disclosing this, and we'll talk about this in the next couple slides, but by disclosing this information, it does not mean that they immediately take away your license and you can never drive again. Oh, sorry, let me turn on the light. It's censored if no one moves. Here we go. Okay. Um,
You have a phantom in your office.
I know I need like something just moving over there. Um, and so yeah, so it does not mean that they immediately take away your license. So I know this is kind of a scary thing to disclose with the DMV, but again, I really encourage you from the legal perspective to do so. So just to kind of get into a little bit more specifics, there are 4 medical conditions that must be reported. These include dementia, diabetes, lapses of consciousness, so seizures, fainting, and then any vision condition. So this could be really low acuity, right? Like really high prescription. It could be any peripheral vision changes, night vision challenges, glare resistance, again, judgment of distances, or that ability to move your eyes and perceive what you're seeing. And these would be, again, like diagnosed, you'd gone to an ophthalmologist, they've diagnosed you with a condition. Those medical providers are required to notify the DMV. Um, so again, Parkinson's is not in one of the must be reported, but they do include it on that other form as something that could potentially impact your driving, and they kind of encourage you to disclose that. So for these 4 conditions in particular, these would require an interview with a driving safety officer, further testing, and or medical forms from your physician. So the 4 of these definitely require more questioning. With the diagnosis of just Parkinson's, adding that to your form, that does not immediately trigger any of these requirements. Any questions about this so far? We're going to kind of get into it a little bit more in detail, but I know it's a lot of information at once.
Maybe you could say what dementia is, define dementia.
Yeah, so the DMV does not define it much more than just dementia, the big umbrella term. Um, from a medical perspective, dementia is impairment in your memory. And so there's a lot of for example, mild cognitive impairment is a really common diagnosis that doctors will use. It's kind of under the dementia umbrella, so it's a little bit that one's a little bit tricky because it's not actually a diagnosis of dementia, so doctors often don't report that to the DMV. Um, Dementia would include anything like Lewy body dementia, Alzheimer's, that type of specific diagnosis that your doctor would have given you. But it's more of a severe cognitive impairment um, than just your sort of memory loss or general cognitive impairment. And then to kind of speak to the dementia piece a little bit more as well, this, like Robin mentioned, sort of with insight in that, that's why dementia is such a challenge because someone, it really fluctuates and insight is often the first thing that is impaired. And so again, if someone's having that inability to really do that self-check and use good judgment, then that's why the DMV needs to know about a dementia diagnosis and really see how far along they would be in that progression of their illness to decide whether they would be safe to keep their license. And then when it comes to diabetes, diabetes is kind of a surprising one, I think, to be on this list. You know, a lot of people have diabetes. Two main things they're looking for when it comes to diabetes, management of blood sugars. So if blood sugars are not managed correctly, there is the risk of, you know, fainting, not losing consciousness basically, so that's one of the things that they're most concerned about. And then also lack of sensation, right? So in really severe diabetes cases, often you can have a lot of numbness in your feet or your hands, which would impact your ability to feel the pedals, to feel the wheel, that type of thing. So that's what they're looking for with diabetes specifically. Okay. So, I just mentioned in this past slide that some of these conditions may require an interview with a driving safety officer. So there's a specific branch within the DMV that's called the Driver Safety Branch. And they are basically responsible for identifying who the high risk drivers are, and then people who basically, are they safe to continue driving? Are they not? Right? So they're keeping our roads safe. um, so a lot of the times when you, and this probably will happen, is the next slide, no. So this will probably happen when you disclose your diagnosis of Parkinson's on your driver's license renewal form. What will typically happen is a driver safety branch is going to review your driver information. So they're going to review your form, maybe look at your history of driving, when did you get your license, do some of that background work. And then often they will call you and they'll do just kind of a quick phone interview to get a sense of, again, kind of your judgment, where you're at with driving. Again, are you making good choices, right? So they're going to ask you some of those questions. Um, if they have additional questions about your medical condition and whether that would affect your ability to drive, then the driver safety will send you a clearance letter that you're going to have to fill out. Or sorry, if after that interview, let me back up, if after that interview they feel that you are okay and that your medical condition will not affect your ability to drive, they will then send you a clearance letter that you are okay, you can continue with your renewal form, and sort of the process stops there. If the driver safety has that interview with you and they need more information about your medical condition, they will have you fill out a notice of reexamination form. And this is similar to what they call the driver medical evaluation. So I think it's about an 8-page form where, again, they're going to be just asking questions about your medical information. You will fill out part of it, and then you will take the forms to your doctor to have them fill out the rest of it. This is where occupational therapy will come in. So if your doctor, because often, right, you're only maybe seeing your neurologist every 3-6 months, and they're focusing mostly on your medical history. They might not be able to really dive into the nuances of your driving ability. So this is when they often will refer you to occupational therapy for a more in-depth clinical evaluation of your driving. So if you take those forms to your doctor, quite often they are then going to place a referral to occupational therapy. We will then complete our evaluation, provide our recommendation back to the doctor for them to complete the forms. Then you will return all of these forms back to the DMV. And typically, if they are asking for the medical information, they will then have you do a road test at the DMV. So you will redo your driving test as you may have done, years ago. Um, this I know sounds really sort of scary, and an inconvenience, right? You've been driving for years, but this really is the best way to kind of put that like gold stamp on your license that you have gone through all the correct channels. They have approved you to be a safe driver. You may continue driving. That really protects you from a legal perspective. And if you are driving well, then you shouldn't have concerns about, going to the DMV to do your driving test. I know it's still kind of unnerving, but they aren't testing really complicated maneuvers. They're just testing really the basics. So don't be nervous about that. Please do not let that sort of deter you from disclosing your diagnosis. Next, we'll talk about the clinical assessment specifically with occupational therapy, but I want to pause there if anyone has any questions about these forms or the DMV process so far.
Alyssa, I had one question, which is if people, you're talking about the process where people are going to renew their driver's license, which I do think is every 5 years. Um, it, is there any obligation if today somebody receives a Parkinson's diagnosis, but their renewal, say they've just recently renewed? Is there any obligation on their part to inform the DMV of their diagnosis, or does nothing have to happen until the renewal?
Yeah, this is one of the hardest questions, and I searched for an answer as well. That's one of the really gray areas. So it does not appear that they require you. Like, there's nothing that I could find that says, within 3 months of a diagnosis, you must disclose. The only language I can find is sort of that retroactive 3 years. Have you had something in the last 3 years? So that would suggest to me that it's not, an urgent, you must go to the DMV right away. With that being said, I always recommend to my patients, it's always worth a phone call to the driver safety branch. I included the number on the last slide of this presentation, but it's always worth just calling them and saying, this is my situation. What would you recommend I do? I've had patients kind of report back after that, and they often get all sorts of different answers. So it's a really tricky question. I think for me personally, if it was me, I would notify the DMV as soon as I could just to protect myself legally. But I have not found anything that says you need to disclose within 30 days, 90 days, whatever that may be. I
Okay,
know
very
that's
good.
not a great answer, but
Yeah, are you speaking at all in the presentation about what a healthcare professional's responsibility is?
I didn't. Yes, from the occupational therapy perspective,
Okay, okay,
in kind of our assessment that we'll do,
okay.
but are you talking about like mandated reporting type thing?
Yes, exactly.
Yeah, so physicians are mandated reporters of those four diagnoses of the four these ones that must be reported. So they are mandated reporters for these.
Mhm.
In addition, I'm not sure exactly what the language is within their like professional standards, but there is something regarding if a patient is in front of them and they deem they are unsafe to drive, then yes, they are obligated to report that to the DMV.
I see. But it's just these conditions or if the physician is otherwise concerned.
Correct. Yep.
Okay, very
Yep.
good. Thank you.
Yeah. And then at the very end as well, I do have the form that you anyone can report anonymously to the DMV. So that's something a family member could do, a neighbor, a friend, anything like that. And I think that is something important because, you know, family members are often in a really challenging situation if they really feel that their family member, friend, neighbor is unsafe to continue driving, but they don't know how to sort of stop that situation. There is a form that you can anonymously submit to the DMV that would trigger the same process where the driver safety office would call that individual, and sort of inquire what their medical diagnosis was, and probably require more medical information to figure out what's going on with driving. So it's just, again, I always recommend people, as much as you can, talk to face with that individual and have that conversation, but that is something that is available as well. Okay, so let's dive into kind of what the clinical driving assessment would look like with an occupational therapist. So we are going to be, so it usually takes about 2 to 3 sessions with us to complete kind of our battery of assessments. It might be faster, might be slower, just depending on the situation. But these would be the kind of the 4 areas that we're going to look at. So we would do a basic strength, sensation, and vision assessment just to make sure, again, back to that very first slide, can the individual turn their head both directions? Do they have enough strength to press the pedal? Can they safely get in and out of the car? Can they feel the pedal? Are they able to, see targets on a screen? So kind of just a overall, can we operate the vehicle? If something were an issue in any of these categories, it again may trigger further assessment. So if we did find something with vision that would be concerning, we would send them to an eye doctor. So send them to more of a specialist to get objective findings. We wouldn't be doing any like specific vision assessment here. And then these are the 3 assessments that we will go through in more detail next. So the useful field of view is the first assessment that we typically do, and this one's done on a computer. It's basically measures the speed of your visual processing, so how fast a target can be detected. It's also going to test divided attention, so can you spot 2 targets on the screen at the same time? And then selective attention, which is the presence of extra kind of visual clutter on the screen. Can you pick out the important information when there's a lot on the screen? This has been extensively researched with regards to driving. And so it gives us a score, or a speed for each one, and then that correlates to basically how likely is someone to get into a motor vehicle accident. A lot of patients will say, what does this have to do with driving? I'm just looking at a computer screen. Again, it's testing that visual processing. So when you're out on the road and suddenly a child, running after a ball is suddenly in your visual field, running across, is your body able to see that information and process what it is fast enough? In addition to, again, the divided attention, can you also notice that there's a car come the other way? So you can't veer over that way. You're going to hit that car. You can't veer this way because you're going to hit the child. You got to hit that brake, right? So your vision does all of this so automatically, but unfortunately with something like Parkinson's, or even just as we age, this process can slow. And so it's really important for us to test that processing speed, as a way to determine whether you would be safe to drive or not. So I should say as well that as occupational therapists, our assessments are all done in the clinic. So we do not actually go in the car with you. So that's why we're doing things that are researched and comparable to driving without actually being in the car. Okay, so the next assessment that we would do is through our driving simulator. So this is a picture of exactly what it looks like. It's a big wide screen, kind of looks like an arcade game. But we're able to test, visual scanning with the big wide screen. Many scenarios are available on this program. So we can really test, cities, suburban, freeway driving, even parking lots, right? Are you able to make those tight turns? We test pedal reaction and steering reaction. We're able to actually get an objective number of how fast you can get from the gas to the brake. Um, just so you know, the goal or what the norm is for that speed would be 0.7 seconds. So very quickly to get from that pedal to the brake. So we will test that. Same thing with the steering. Something pops up on the screen and you have to turn that wheel super fast to get out of the way. And there's also really cool modules in there that actually have all of these unexpected hazards. So a lot of the scenarios I've brought up already, right? Someone stepping in front of the car, a yellow light changing really fast, a construction zone. So all sorts of things happening. We are just observing to see what your reaction is and able if you're able to process and make good judgments during those times. There's also some really great specialized modules that focus on divided attention and the ability to follow maps and verbal instructions. So again, just a lot of ways that we can really uh, take a look at what's happening inside your brain and if you would be able to make those good choices out on the road. The simulator is not perfect. It does not feel exactly like a real car, but it is kind of the best we have to keep everyone safe while we're doing these assessments. And we always say to folks like we're not looking at your exact ability to operate the simulator perfectly. It is a little, sticky and things like that, but we're able to really see what would go on in your mind during those hazardous situations. All right, and then the third assessment that we would do is a full kind of neuropsychological test that would help evaluate the cognitive functions that are essential for driving. So this is if any of you have done this already, you will know that it is kind of a bizarre assessment. It really feels like it has nothing to do with driving. There's some just kind of strange activities or strange things that get prompted, but we are testing brain areas that are relevant to driving. So it gives us a really clear score of if your score is greater than 10, that would indicate that the individual has failed and that you would have a 90% chance of failing an on-the-road test, and it would be a strong indication for that it's unsafe to drive. If you're in that middle area from about, let me get the light. Okay. Um, if you're in that middle area, about 6 to 10, this would suggest difficulties with driving and that probably a road test would be appropriate. And then anything lower than a 6 would indicate that safe driving is probable. But obviously, this is just one assessment, so we would take into consideration that computer test and also the driving simulator to really make a correct or accurate prediction of your driving abilities. So that's kind of why the whole thing takes a few sessions to really look at all aspects of you and how that's going to impact your driving. So ultimately, the results of the occupational therapy assessment we kind of put it into like red light, yellow light, green light. Red light would mean, unfortunately, what we've seen would be a strong indication that it is not safe to continue driving. We would report these findings to the medical team, and then ultimately they would complete the DMV paperwork. If you had presented them with that form, then that's where they would indicate that information and return it to the DMV. If this assessment was done um, without sort of those forms and it was just brought on by the physician having concerns, then this is where they would complete that those forms to the DMV to just inform the DMV that you are no longer safe to drive. The yellow light would be we're kind of in that gray area, the great gray area where we're not exactly sure. We're seeing some good things, but we're also seeing some question marks. Some things may just require a little bit more training with an occupational therapist. It might be something simple as you're just having that rigidity in your neck and a really difficult time turning your head to check blind spots. So maybe we're going to do some therapy to improve that range of motion, improve your posture, and then retest and go from there. Maybe we feel like the clinical assessments just aren't giving us enough information, and we really want you to have that road assessment done. There's two ways that you can do kind of an on the road assessment. One way would be through a certified driving rehab specialist. This individual is actually an occupational therapist. They just have an extra like certification, extra training that they are allowed to be in the car with you. They would do more of a medical assessment with you on the road. And this, they would really be looking things like, do they need an extra mirror on the car because they have that limited range of motion? Could we add an extra mirror that then would make them safe to drive? Or could we add a certain type of knob on the steering wheel to make steering more fluid? Could we move the signals to the other side of the steering wheel so that the tremor on that side doesn't impact it? So if you're looking to really modify your car or really adapt things to make it work for you, then this would be the route that you would go. It is quite expensive, unfortunately, and not covered by insurance, but it is an option for you if that's something you would want to do. And we would walk you through, obviously, all of this during our assessment.
And
Um,
have you seen that be effective where people can move the signal to the other side and use it effectively, drive effectively?
yeah, there are definitely scenarios where just little fixes like that could really help someone. And so when I think about that, it would be that example of someone who, is not having any vision changes, not having any cognitive changes. It's only a tremor, right? Or something like that, um, they're a green light for everything else, but there's just something that's making them slightly unsafe. There's definitely ways you can modify the car, to make it work.
Cool.
Yeah. And then all of that, I should say too, once you're working with that certified driving rehab specialist, they would then fill out different paperwork to like notify the DMV of the changes to your car. So similar to, if you wear corrective lenses, that has to be identified on your license. That's a similar sort of story where they would fill that out to say like this patient, requires this extra mirror, or requires whatever it may be, to drive safely.
And can you help families find certified driving rehab specialists?
Yes, absolutely. I should have included that link. I will include it in the PowerPoint before I send it to you, and that way it'll be in the final one.
Okay, great. Great.
Yeah. Um, you had said this is mostly local folks, yeah?
Yes,
Okay.
yeah, we're all local.
Yeah.
Yeah.
There's the one that sticks out. There's one in San Francisco. It's called Apex. Do basically most of the Bay Area, but yeah, they're called Apex. I've heard really great things about their program.
Okay. Okay, great.
Yeah. And then, okay, so that's kind of one route you can go for on the road assessments. The other route you can go for on the road assessments would just be with a general driving instructor. So this would be, same type of company that you may have done when you were, 16 and learning to drive. Um, there's tons of these companies around. I don't know any specific ones, and I'm certainly not tied to any that I would promote. But you can easily Google just basic driving instructors. Most of them have a section for adult drivers, and this would be basically you're paying for just a one-time assessment with that instructor to get feedback on how your driving is. Um, we're kind of using them as our ears and eyes, right? So if they sort of have large concerns with what's going on, they're certainly going to advise you to stop driving and to follow up with the DMV. If it is something where they, feel, oh, you know what, you did really well, but you're just having a little bit of trouble with your speed on the highway, maybe we could do 3 sessions together to help improve that. So that's kind of, they're going to do their own assessment to kind of see where they're at. But again, it's just a nice way that we can get kind of ears and eyes on the road in a vehicle with someone who's trained and would have the ability to kind of control the situation if something were unsafe. So again, this is obviously not covered by insurance because it's something completely separate from the medical system, but a great way to just get feedback on your driving before returning to the DMV. And then anyone kind of in that yellow light category for us, we ultimately are going to recommend that you have a re-examination at the DMV. So we're going to recommend that you do that road test at the DMV, again, to get that gold stamp of approval on your license to say you are good to go. You've gone through all the correct channels. Yes, I have Parkinson's, but I am safe to drive, right? So that's kind of the yellow category. Green light would be you fly through all of our clinical assessments. You look great. We really don't have any reason to believe that you're not safe to drive at this time. We would discuss maybe some safety recommendations with you, things like avoiding multitasking while you're driving, right? Don't change the radio or try and, change a bunch of settings. Avoid talking to someone as you're driving, maybe avoid rush hour times as much as you can, or limit nighttime driving. So just basic safety recommendations. But ultimately, we would report our findings to the medical team to let them know that we feel that you are safe to continue driving, in which case they would complete that paperwork for you. You'd submit it to the DMV, and then it's in the DMV's hands. They're ultimately the ones that are going to decide, do they feel comfortable with this information in order to not do a follow-up driving test, or do they still want you to do a driving test to see how you do? And so I should say too, as kind of like a disclaimer, like the DMV always has the ultimate reign over your license, right? So anything that the medical team is doing, we are just providing information to them or advising them on what we're seeing from a medical perspective, but they ultimately have the power over your over your license. And through all of these process, there is the option to appeal at any time, right? Unfortunately, appeals are generally not very successful because the appeals are going to then be based on further medical paperwork. So if your medical team really feels strongly that your medical condition is impacting your ability to drive, an appeal is just going to be very challenging. So just wanted to kind of put that out there. Okay, and then I mentioned this kind of briefly before, but this is how you would submit an anonymous letter or form to the DMV to report an unsafe driver if that was necessary. I have actually done this with a patient before to kind of help empower them that they're making this decision. Uh, it's really important. Retiring from driving is it's a really challenging process, right? It's something that's really linked to your identity, your independence. So we really don't take this lightly, that making the decision to give up your license is a huge deal. And so I really try and put it in the hands of my patients as much as I can. I want them to come to the conclusion and make that decision, when they feel comfortable. And so often, when we've had a few sessions together, we've talked it through and they've really sort of seen where they're having challenges, then I will sit down with them and say, like, why don't you fill this out, right? You're not having someone report you. You're actually going to fill out what are the things that you're having challenges with and why do you think that you should stop driving? It just helps kind of help them go through that kind of process and grieving process. So again, as a family member or friend, I always encourage you, like, try and have that conversation as much as you can without just, blindly reporting someone. All right, so just some final thoughts. Again, I said that's at the beginning of the presentation, but please consult the California DMV website for all up-to-date laws and regulations. I did pull a lot of links and different paperwork from the DMV website, but again, things can change at any time. So please, please, please go off of the website. Do not go up from my PowerPoint. And then for specific questions, you can always contact the driving safety branch, and I put the number there. Ask all sorts of questions to them, and they will hopefully be able to direct you in the right direction. All right, that's all I have.
Okay, that was fantastic. Very detailed. Thanks, Alyssa. I don't know if anybody has questions, but both the chat and the Q&A are available. Back to the length of time it takes. You mentioned several stages. How long, how quickly, how soon can somebody actually make an appointment, like to be assessed at Stanford and go through all the simulator and all of that stuff? How long does that whole process take?
Yeah, so thankfully, our team has grown in the last 1 to 2 years. So we actually have five occupational therapists on staff.
Wow.
Yeah,
Wow.
some of us are part-time or relief, but there is five of us.
Wow.
So thankfully our wait time is not much at all, probably about a month to get in. So not bad.
Yeah.
Not bad, but it's been historically, and so, yeah, please feel free. That would be the other thing I would say too, if you just if you feel like this is kind of all overwhelming and you're like, I just want to talk through this more specifically and really assess my driving, you can always do it. Like you can always initiate the process, right? It doesn't always have to come from your physician or someone that's
Mm.
concerned. You can always ask your doctor, like, hey, I want to check my reflexes. I want to make sure I am safe. Then yeah, we can do that assessment, no problem.
And do people have to be Stanford neurology patients or somehow being seen at Stanford in order to get into driving assessment with an OT at Stanford?
Yes, I believe their current process is accepting referrals from a Stanford neurologist. Yeah.
Okay. All right. Let's see.
We do, I will say we do occasionally accept them from Stanford primary care as well. So I would say just always ask. We can always, there's often the one-off or things like that. If 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 we can get you in, I hope we can.
Right. Yeah. And how long does the assessment take normally?
Yeah, so typically the first assessment on the first day would be an hour. Usually we can get through that computer assessment, all of the basic screening questions, the strength assessment in that first session.
Oh,
And then,
really? Wow, that's very
yeah.
action packed.
Yes, it is. It's a busy first appointment. And then we would typically do one full 40. So all of the follow-up treatments are 45 minutes. Um, that we would do one full session on the driving simulator and then one full session on the cognitive assessment. So again, might be longer than that, might be shorter than that, depending on what we're kind of seeing. But I would say
Okay.
on average three, three appointments.
Right. I had someone say to me, and you kind of mentioned this as well. They said that they felt that being in the simulator, that it wasn't normal, that it wasn't a realistic scenario. What would you say to that?
Yeah, it's very common that we would get
Yeah.
that response. I mean, if you've been in an arcade game, it feels much more like that. So there is a little bit of like motion sickness sometimes
Mm,
because you're sort of in this simulated screen, but you're not feeling the motion. So you almost like feel this weird sensation when you hit the brake of the simulator. Um, what I say to folks, again, I'm not looking for perfect driving in the simulator. I'm looking for good judgment, right? Your ability to notice that the speed limit is 50 and you're trying to keep that 50. It's okay if you can't hold that exact 50, or, it's okay if you go over the line slightly, things like that.
mhm,
We're just looking overall for good judgment on the road. And a lot of the times, if patients really, so there's some folks that just can't quite figure out the simulator. It feels different for them and really just can't make it work. Those are the ones that we're going to direct to the on the road assessment. So whether that's like a driving instructor, the OT on the road. Um,
mhm.
so we definitely talk through that option of, if you really feel like this is not reflective of your real driving, then there's other options that we can get them on the road.
Right. And are all the assessments you're talking about at Stanford, are they all covered by insurance?
Yes. Yeah.
Okay.
All the ones we would do clinically are covered. Yes.
Okay. So it would only be the either the driving school or the on-road assessment by a certified driving rehab specialist that
Yeah,
would.
you got it.
Okay. All right. Very good.
Yeah.
Let's see what else. Oh, and would the cognitive test, is a cognitive test something that we would find that we've seen something like that before? Is it sort of a normal test like the mini mental status exam or the MOCA? Is it something like that that we might have seen before?
It has similar aspects to it. It's a little bit more hands-on. So there's a few components of it where you'll be presented with it almost looks like a science experiment, and you have to like get an object out of a different object without touching certain things, like kind of like a mental puzzle, if that makes sense. So it's
Hmm.
a little bit more hands-on. There's a little bit more like drawing components to it, a couple more like listening type activities. So I would say similar to kind of the mini mental or the mocha ones that you might have seen before, but um, yeah, a little bit more hands-on, a little bit less like just writing pieces to it. And this one is certainly longer, so it usually takes the full 45 minutes.
Yeah, that's a long time. Yeah.
Yeah.
And
It,
are those three appointments? So day one is a full hour. Uh, a second appointment is a simulator, and the third appointment is the cognitive test. Both of those are 45 minutes. Is that usually over 3 different days, or can some things be back to back?
Yeah, most often they're going to be separate days. Occasionally, on some of our relief or part-time staff, often have a little bit more flexibility to potentially like go overtime a little bit to like finish up one, an extra session or something like that, but not
Hmm.
the norm. So I
Okay.
would
All
say
right.
prepare for you would come just for the initial evaluation, then we would talk through what we're seeing initially, and then you would book the two additional ones or however many after that first visit.
Right.
Yeah, but we always
Okay.
just say kind of prepare people that it might take more than one. We've had a lot of folks in the last few years that will come, thinking they're going to get their full answer in that first session, and then
Right.
it's so disappointing to be like, oh, you got to come back. We need
Yeah.
a little bit more
It's
information.
sort of like traditional physical therapy or occupational therapy.
Exactly.
You have to keep
Yeah.
going back till you're done.
Yeah.
Yeah. Okay. That's it for my questions. I don't, does if anybody in the audience has questions, please use the chat or the Q&A. Otherwise, we'll thank Alyssa. And this driver safety branch office number, that's for the California DMV driver safety branch.
Yep. Yep. And then
Okay.
I believe you get routed to I want to say every DMV has a specific one, but it might not, it might be a little bit more region based.
Okay. Some more local or
Yeah.
county area office. Okay.
Yeah.
All right. Okay, I do not see any questions, so we'll end here. Thanks so much, Alyssa. That was a
Of
great
course.
presentation. Really learned a lot myself, and it's
Yeah.
always good to get a refresher on this because it's definitely a down in the weeds kind of thing. And it strikes me that back to your very first slide about the physical, cognitive, and visual. It's not just people with Parkinson's disease. It's all of us.
Absolutely. Yeah,
So,
absolutely.
regardless of age,
Yep.
yeah,
Yeah.
all right.
Yeah. Well, thank you so much for having me. I
Yeah,
really
thank you
appreciate
very
it.
much. See you next time.
Bye.
Bye-bye. Bye, everyone.